Hello everyone, today I'm here to talk about technology in healthcare. Everyone knows that technology has helped the healthcare field in more ways than one. However, let's not forget that it has also hurt the healthcare field. First, we can talk about the pros of technology and how it has helped. If we take a look at slide 2, more information can be shared more quickly. Doctors don't have to wait to receive chart information. And administrative personnel can send it over to their doctor of choice with a click of a button. Test results can be put up on your personal patient information site, and you can see results as they come in. You don't have to necessarily wait till your next appointment. It is more efficient. Less staff can be hired in the office because everything is on a computer, and while charts are still being used with the computers, the files do not have to be pulled right away. Administrative help is spending less time with the paperwork and more time with the patients and taking more phone calls for more appointments. EHR notes or electronic health records can be printed off, and then these can be filed once or twice a week so that the paper files are up to date. And this is in the event that if the system were to go down, you'd still have all your information about the patients kept in their paper files. Also, test results is more accurate, and they take less time with more efficient, high-tech machines. With less time having spent on writing out all notes, doctors can see more patients. They can now type as you talk to them instead of taking 10 to 15-minute pauses to write down what they need, even though some patients don't really like that. I recently spoke with Joshua Render, who works for Unisys IT Services, and he's previously worked for IBM. He has a bachelor's in computer information systems, and he's nearly done with his master's in computer and business management. While working for IBM, he also helped work on a couple different healthcare software programs, and he had some interesting things to say about the efficiency of computers in the healthcare field. He stated overall, computers have allowed a reduction in staff and administrative positions, and if done properly, streamline operations, making them more efficient. They are able to budget quicker and easier. They can find larger pools of potential employees, networking with other people to learn more efficient practices. They reduce needed floor space for storing of some of the records and accessing records in the time it takes to query a database is much quicker. So as you can see, there are some great benefits to the advances in technology in the healthcare field, but on another note, there's still downsides to all the technology changes. So let's take a look at some of the cons of the technology. If we take a look at slide 3, the number one downside to technology advances, I would have to say would be the increased security risk. However, Josh seemed to disagree with me on this downfall, saying that he didn't believe there is a high risk, assuming proper precautions are taken. A lot of the risk would evolve around hospital or office staff, but you can't always assume that the proper precautions are being taken. And according to the FBI Fiscal Crimes Report in 2006, it suggested that advances in technology and electronic medical data have actually caused healthcare fraud schemes to evolve. The FBI has developed a significant amount of expertise in investigating technical schemes involving medical data theft and other fraud schemes facilitated through the use of computers. Next, converting may actually end up costing more. While you will not have as much administrative staff, what if the office is not equipped with the capabilities of handling the systems or the networks that need to be in place? It can cost thousands of dollars, and it's not just a one-time cost. Repairs need to be made, updates, operating systems will need to be updated as they're advanced, and so forth. Employees who are not trained properly can inadvertently share information they're not supposed to. Actually, Josh agreed with me on this one. When talking, he stated that learning curves can vary by staff experience and the complexity of the systems used. Um, if the software isn't particularly good, it can cause the learning curve to be longer and more expensive, because you're going to have to spend more on training your employees to use it. More mistakes can be made. He actually gave a very good example of how easy it is to have something go wrong. He stated that while he worked at IBM, they used to put USB drives out in the parking lot, and they would see if employees would pick them up and use them on the corporate computers. If they were used, it was announced that that USB had been activated. As I recall, he stated it was around 5% of them were used and 85% were recovered. When mistakes are made, information can accidentally be put out in unsecure places, making it easier for other employees to get at that, or hackers to steal that information. Also, patients don't really like the new technology, and they don't trust that all their information is in computers. Patients will actually get kind of angry about it and voice their opinion. It's very hard for the administrative healthcare workers to explain how this system works. Sometimes patients will even refuse to give you information because they don't want it on the computer, or they don't want it shared via the computer. Now, you may ask what can be done about this. If we take a look at slide 4, there are many things, but the two main things that need to be worked on the most is the secureness of the information and the training of staff. The more properly trained employees are on using the system, software, and handling patient information will mean there's less room for mistakes. This goes for security training as well. The staff needs to know what security measures they should be taking with all information. Also, limiting the information that is accessible to certain staff members is a good way to cut down on information being misused, and also a very good way to narrow down the person who did misuse the information. Josh stated that would be a very big help. Having a secure network is a top priority. If the network is not secure, anyone can have access to it. Make sure to educate your patients. Often many people do not like what they don't understand. Let them know how the information can be used versus how it cannot be used. Let them know the precautions you have in place. It may help to calm some of their anxiety about giving needed information to the administrative staff. If we take a look at slide 5, there are also things that patients themselves can do. It should be taught to them as well. Checking each insurance benefit explanation sheet they get. Are the charges correct? Did they receive those services? Allow them to ask questions and let them know that you're there to listen and help answer what you can. Patients can create a name and username and password to view their health information. This is good for them to do so that they can monitor things that way too. If any activity is suspicious, or you let them know if they did not receive services, or they're seeing double billings or something like that, then they need to report it. Again, I'm not denying that all technology advances have helped the healthcare field, but I do think that it has also hurt this field. Are there any questions before I leave today? What are some of the practices that nurses and doctors can do in order to help protect this information? I have talked about some of the ways that nurses and doctors and really all employees can do to help protect this information. But some other ways could be to make sure your computer is locked anytime you do not have it with you, or when you walk away from it, anything, make sure it's locked. This way the information on the computer is out of sight to patients, other people coming into the office. They don't need to see that, so it is a good idea to make sure your computer is locked. Another good idea is to have the screen shields put in place. These are devices that you can hook to a monitor so that if you're not looking directly straight at the monitor, you cannot see what is on the screen. This makes it better so that patients who are checking in or checking out cannot see what's on the computer screens, like lists of patients who are coming in that day. That is information that other patients do not need to see. I hope that answers your question. Thank you for asking. If there are any other questions, I'd be happy to answer them later on. Thank you.